Welcome to another edition of Inspired Stories, where leaders share their experiences so we can learn from their successes, how they've overcome adversity, and explore current challenges they're facing.
Welcome to another edition of the Inspired Stories podcast, where leaders share their experiences so we can learn from their successes and be inspired by how they've overcome adversity. My name is Anthony Codaspoti, and today's guest is Donna Sneeringer, Vice President and Chief Strategy Officer of Childcare Resource Center, a community-based nonprofit organization that provides an array of services largely focused on helping families raise their young kids to get them off to a good start in life. They work to provide childcare support, connect families with childcare options, including both private care as well as Head Start. They coordinate payments for care and offer additional support such as home visiting, mental health consultation, and more. Their organization also oversees government relations and research efforts to drive public policies and funding related to childcare. They currently serve about 50,000 kids through their subsidized childcare voucher program. Donna brings a wide array of experiences to the job, including government affairs, public relations, public policy, nonprofit management, early care and education, and child advocacy. Now, before we get into all that good stuff, today's episode is brought to you by my company, Add Back Benefits Agency, where we offer very specific and unique employee benefits that are both great for your team and fiscally optimized for your bottom line. One recent client was able to add over $900 per employee per year in extra cash flow by implementing one of our proprietary programs. Results vary for each company, and some organizations may not be eligible. To find out if your company qualifies, contact us today at addbackbenefitsagency.com. Now, back to our guest today, the Vice President and Chief Strategy Officer of Childcare Resource Center, Donna Sneeringer. Thanks for making your time to share your story today.
Thanks so much for having me. I really look forward to the conversation.
All right. So tell me about the path, Donna, that led you to your current role at CCRC.
Well, careers are a journey, as you know, and I started off with a degree in child development from Cal State Northridge as a young person, and realized pretty quickly that I wanted to work on behalf of kids, but not directly with kids, and fell into a job at the Childcare Resource Center when it was a very small nonprofit. In the earlier part of my career, I spent many years working there in a lot of different capacities, doing program work, helping families find childcare, working with childcare providers to improve their business, and eventually took a different position with another agency in Northern California, spent about 10 years there and started to get more and more involved in public policy. Went back to school, got a graduate degree in public administration and political management from USC, and really made that transition to leaning into how do we make better systems and how do we really craft access to supports and programs for families and what they need today. And so have been working in that ever since, have been with CCRC again for about 11 years and really enjoy the work I do. Every year is different, and it really does give me an opportunity to take my collective knowledge from all the years of working in this industry and try to make things better, try to look at things more holistically, and try to work with decision makers and program administrators to innovate and create the best services that we can.
So what's the size difference between when you were first with the organization and where it is now?
So when I worked for CCRC at the beginning of my career, I was their 28th employee.
Okay.
And we now have about 1,300.
Wow, that's a pretty big size difference.
It's a pretty significant size difference. And there were some major policy shifts at the national level and in California over the past couple of decades that really gave that opportunity for growth. But also it came from really expanding our view of the work that we do. So instead of just relying on the core services we started with, really branching out and adding in Head Start, adding in a lot of other supportive service contracts so that we could really be holistic in our approach. And it really allows us to provide the greatest opportunity to the kids and families that we work with.
What were some of the national policy changes that took place, which sort of opened up some of these opportunities for expansion?
So in the early 1990s, the country passed the first Childcare and Development Block Grant legislation, which is funding to help families pay for childcare. And it is a program that still is in existence. It has grown over the years slowly, not as quickly as it probably needs to. So that was the first real major investment that was made at the federal level. And then welfare reform made some major changes also in the later part of the 1990s, where there was an acknowledgement that you couldn't really ask parents to go back to work if they didn't have care for their kids. So you had a big shift with that. And then more recently, really since the pandemic, there has been both a national and state understanding of the critical importance that childcare plays in making sure our economy runs. It was maybe 2 weeks into the pandemic in 2020 when Governor Newsom at the time declared childcare to be an essential service, because if nurses, doctors, first responders, people that worked in food service, logistics, if they couldn't get to work because they had nowhere for their children to go, everything would stop. And so we were pulled into that essential service band at that point. And I think it really was an eye-opening experience for many folks who hadn't really paid attention to the critical role that childcare played in people's ability to get to work. That really did change things pretty significantly for us.
It wasn't like COVID was the first time that childcare was important. It was just the first time that maybe a bigger spotlight got shown on it. So people who don't have kids of that age are like, oh, yeah, I guess that makes sense. There won't be a doctor to see me or a nurse to help me out if somebody isn't there to watch their kids.
Absolutely. And it's often been a hidden conversation. It's a conversation that parents, often moms, to be honest, try to deal with quietly behind the scenes and have historically. There's a lot of familial support that happens where you have family relative caregivers, but there also is the formal child care system where you have child care centers, licensed family child care homes, and folks who provide this service as a business. So I think that we've sort of just let it be a hidden issue, something that I think from time to time it bubbles up for employers that it's an issue for their employees, but when it really came down to they can't come to work, that was really an eye-opening moment. And I think, particularly for folks in the healthcare space, but if you think about those of us who were lucky enough to shelter in place at home, we relied on Amazon. We relied on, Grubhub and food delivery, and we still there were core functions that still had to keep going, and the people that worked in those places needed that support.
And of course, that remains true even today.
Absolutely.
There's still workers across, all kinds of different parts of the economic spectrum that still need that kind of help. And for some families, at one end of the economic spectrum, they can afford to pay for the care. Folks maybe in the middle can afford part of it. Some folks can't afford. So tell me how you can kind of step in and help people, at all different stages.
So I think it's important to note that childcare as an industry is a textbook example of a failed economic market.
Interesting.
Because the economics of childcare don't pencil out. The cost of providing the service is more than the families mostly can afford to pay.
Yep.
And almost every dollar you pay for childcare goes into paying the workers who care for the children, but their wages are very, very low. And so one of the ways you overcome a broken economic market is through public investment. And so that is really what we have seen begin to happen with the changes that have happened over the past few decades, where you had an influx of funding from the Child Care and Development Block Grant, from the Welfare to Work changes that happened in the 90s, and with a lot of money during the pandemic for pandemic relief. Childcare was front and center in many of those conversations to try to fill that gap so that people could have the care that they needed. So the programs that we run are two types. One where we enroll families based on their income and we assist in paying for their care. It's limited. There aren't enough dollars.
Sorry, Donna, just to clarify, are you enrolling them in one of your centers or?
No. So we're enrolling them in a financial assistance program where they can pick care. They can pick a child care center, a family child care provider, a family friend or neighbor, and then we make arrangements to pay for the service up to a ceiling that is set by the government. Then we also run direct care programs like Head Start or state preschool, where we actually run the child care facility and we enroll the families in those programs and serve them directly there. So we do both types of support, but it is something that is in demand. We just had a pretty major expansion of our funding in California. One of our major programs for working families had significant investments made in it. Governor Newsom made a commitment, and he has thus far quadrupled the size of the program.
Wow.
And we are now again fully enrolled and have 30,000 kids on a waiting list. So the need for this service so far outstrips the available benefits that there is a constant pressure to try to make sure that we can serve as many families as possible, and thus the advocacy and education that's needed to make sure that people are aware of this gap.
Is all the funding come from different levels of government?
Yes, primarily the funding comes from government. As I mentioned, a lot of it originates at the federal level. The state of California is pretty generous in their contributions. We do have some local government engagement. I think you'll see in the news periodically that there are local government initiatives that have passed in different jurisdictions where they're trying to add to the solution. And it is something that I think is getting the kind of attention it probably has needed for a long time. And there's more work to do to really fix and build the system for the future.
Any thoughts on where that additional funding can come from? I mean, as I think about sort of the public school system, K through 12, I believe that most geographies fund that through property tax, correct?
It varies from state to state. Some states don't have property tax. Some states don't have income tax. So you have a little bit of variance depending on the state. But clearly there are public investments needed to overcome this shortfall. And we live in a world and an economy that is running 24/7. Most families, every able-bodied adult needs to work to help make ends meet. And really having access to these types of support is going to be critical to maintaining our economic strength and our ability to grow going forward.
So I'm 50 years old. When I was a kid, obviously I didn't understand what was going on in the world, but I don't remember childcare being a thing. Did I just grow up in a bubble, or has it become way more prominent now?
It has become way more prominent. I'm around your age, and I also probably had no idea that this was an issue. But I also grew up in a time where it was very common to have mom at home.
Yep.
And that has changed. We have a very different world. And while there are families who make that choice, and that's a valid choice if it works for them economically. For many, it doesn't work. You have single parent families where that's not an option at all. And you have generations now of working women who have tremendous education and skill that they're bringing into our country and into our economy. And the loss of them from the workforce at this point would be really difficult. I forget, I was at an event a couple years ago, and over half the graduates from MIT in engineering are women. So it's, the odds of this spinning backward to where you and I grow up is not likely. And for many people, I think it wasn't really real then either. And for those that it worked for, it worked, but it wasn't ideal even then. And a lot of the programs that we administer really started in the mid-1970s. And if you think back even further in history, the first time the United States had a major investment in childcare was during World War II. And the reason was we needed Rosie to go do her work with the rivets, and we had to have a place for her to put her kids. So the federal government during World War II passed the Federal Lanham Act, which set up the nation's first subsidized childcare program to support the war effort. So it's not a new concept. It's certainly been emerging. And I think it is something that as we have had more equality in the workplace, more opportunity for women, more opportunity for families to make individual choices, and if that means pursuing career, that there are ways to support this differently.
So a couple of the ways that you help families is you can either enroll them in your own programs, or you can help to fund care, through other methods, whether it's a family member or a friend who's taking care, or a small child care center, or one of the bigger standalone centers. And so how do you sort of decide who gets which type of service, or is that something that the family gets to choose?
The family gets to choose. A lot of it is based on availability and where there are opportunities to enroll. As I mentioned, we have waiting lists. So if you get an opportunity to take a space that's in one of our facilities and there's no availability for the portable financial assistance, then you'll take what families take what they can get typically. And then if you are in our financial assistance program where we assist in paying for care, it is a parent choice program. It is governed by a federal statute, so the family can pick whatever type of care they want. And then they are able to pursue the type of care that meets the needs of their kids and their family. One of the things I'll put my child development hat on for a minute is what works for your 2-year-old might not work for your 4-year-old or your 7-year-old, and the needs of families change over time. Often they have more than one child. So the beauty of our financial assistance programs that allow parents to choose is they could change providers. They can use more than one provider at a time. And as their children grow and start school, they may not need a full day experience, but they do need before and after school care. And we have many, many families who work in our 24/7 economy who need care evening, weekend, holiday, and that program allows for them to find that during those hours they need it as well.
Can they use that financial assistance anywhere, or does it have to be like on a list? Is it a place that has to be on an approved list?
So it varies from state to state. And in California, they can choose licensed care that is licensed by the state of California. Most states have some sort of licensing system. We also allow for what we consider to be license exempt, which is the family, friend, and neighbor option. Some states do that, some states don't. So the rules do vary nationally a bit.
So there are a number of other organizations like yours around the country that provide similar services.
There are. And because the Federal Child Care and Development Block Grant is a national program, there are organizations or state agencies that do this type of work. We work through a national association called Childcare Aware of America, where wherever you are in the country, you can go on their website and you can identify where you could find a resource and referral agency like us that will then connect you to what is available in your state and in your community.
And so are you the only one in your geographical region? You're the only one in California? How does this work? Do you get territories?
So we are regional. We all are assigned territories based on our contracts with the state. In California, there are about 60. California is a pretty big state.
Wow. Yeah.
Yeah. California is a big state. So we have 58 counties. And so we've got some areas where there are more than one, some areas where there's only one, some areas where one agency covers multiple counties. It's, depends on the population density. And it's all driven by the population base, where young kids are, and how the agreements are set up.
Are they all set up as nonprofits?
Most. Some are also in county offices of education, so the local school districts may have these contracts. A handful are in local government in counties, but I think the majority are in community-based nonprofits in California.
So no for-profit organizations that are set up like this?
No, we're all nonprofit-based.
Do you feel like you're in competition with any of these other organizations? Are you competing for dollars or attention or anything else, other resources?
I think in the nonprofit community, we are pretty collegial. We all work collaboratively together. We have to transfer families. If a family is receiving services from us in Los Angeles and they move to Fresno, we work with the agency in Fresno to make sure the family's services follow them. We are seeing more for-profit competition coming in. The challenge is they don't necessarily have all of the information. They aren't connected to the licensing entities, and they may not have the full picture, where we are, as contractors of the state, given regular updates and regular information so that we are giving families as complete a picture as we can of what's available in their community.
What does for-profit competition look like? Because it seems like the majority of your funding is coming from the government. Can for-profit entities get access to the same kind of funding?
They are funded differently. Often they are working with businesses, trying to work to support employees that different businesses may be trying to provide childcare services to. I think one of the things we are really eager to make sure that the broader community understands is some of the things that they are offering are already paid for by public funding. And the businesses really could access these private community-based nonprofits rather than having to expend resources on a for-profit entity. But there are different services that they are offering. It's a pretty new development, so we're trying to figure out how all the pieces may fit together. But we certainly want to make sure that people know that there are already available services, and that whatever the for-profit community brings in is a value add and not taking away from existing resources that everyone should be able to access.
Because it sounds like you're at full enrollment, you've got a pretty big waiting list, so this could be a help to that, right, for those folks who are on that waiting list.
It could be, and one of the things I know some of the companies we've been talking to, where there are employers who want to offer, say, a child care benefit, where they want to provide a stipend to their employees to help offset the cost of childcare. There are different arrangements that could be made, and we would be eager to do those things as well. But it's a difficult landscape for employers. I think many times employers are pressured to provide the care or provide an on-site childcare option, and that gets complicated. It's a complicated business to run. If you have a brick and mortar childcare facility, you often can't meet the needs of all of your employees, and your employees' needs are changing every day. Their children are growing. You have new employees that come in. And then there become equity issues with your employees that don't have children, that you're providing a benefit there than not for them. So, we really encourage employers to seek out their nonprofit partners and see what we could do to help them support the broader community-based childcare system and not take that responsibility on themselves when for many it's just a burden they're not ready to get into.
Donna, help us understand what a chief strategy officer does.
I'm creating it as I go. I think my job really is to be up in the crow's nest of the ship, seeing where we're headed, what possibilities are out there, what threats are out there, and how we can really position our organization to meet the needs of our community, live up to our mission, and identify resources to expand and strengthen our services. So in my work, I oversee all of our external communications work. We have a pretty robust presence in social media. We do a lot of video work, just basic education, trying to help families understand what's available to them, a lot of local outreach and engagement. And we also do a lot of work with childcare providers to make sure they have the resources that they need to run their business. I'm also responsible for our research division, where we really take a deeper dive, do a lot of needs assessment work, looking at where there are gaps, what families are needing right now, what their day-to-day reality looks like, and how we can design a system that meets their needs. And our government relations team, where we are really trying to partner with our elected officials and their staff to make sure they are up to speed on the realities in their communities. We do a lot of education, trying to explain to them what the childcare supply looks like, where there might be what we call childcare deserts, where there's not enough care to serve the number of kids that are needing support, how many families are receiving subsidized care, how many families are in need of additional support, and really trying to, as I said, craft the best solutions for the most people.
I've had the chance to talk with a number of childcare center owners, several across the state of California. And so anecdotally, I get to hear a lot of stories about, COVID was really tough. Some people are still trying to recover from that. A number of centers never recovered. They shut down, they went under, probably contributing to this childcare desert that you're talking about in some locations. Again, like the stories I get to hear, they're anecdotes. There are many of them that tell the same kind of story, but I'm curious from a data point of view, what does the big picture kind of look like coming out of COVID?
So coming out of COVID, I think what you're hearing anecdotally is what we're seeing more systemically. We are seeing a lot of providers that are, struggling with the increased cost of doing business. One of the challenges is just your cost for your employees has gone up. We've seen multiple minimum wage increases in California, which is great for the workers, but with such a small margin on your business, there's very little room for error. And I think we've also seen in California a pretty significant increase in public investment in school-based preschool, where a lot of 4-year-olds are now going to a transitional kindergarten program at their local elementary school. And often for childcare providers, that 4-year-old age group was critical to their ability to break even financially. Because of the adult to child ratios with younger children, that was kind of that age group where they could really hold it together. So we really are seeing a lot of struggling in our childcare provider community. We also have an aging population of family childcare providers. The folks who are licensed to do care in their own homes, they are reaching retirement age or past retirement age and still doing that work, and the influx of new people coming in is not as quick. And for many reasons, the workforce in childcare has largely been women, often women of color, and it has been not a well compensated field historically. And the good news for women is there's a lot more opportunity for women, and you've got a lot of women getting a much more robust education, and they have a lot of new opportunities where they don't necessarily have to take that lower paying job. And we as a society have grown accustomed to having that cheap labor, and that's going away. And I think that's part of the pressure on the system is, well, what are we going to do to make these competitive wage jobs to attract young people to want to work with young kids? I think it's some of the most important work you could do. We know that the first 3 years of a child's life are the most rapid period of brain development. There's very few times that you can have that kind of impact in the lives of others, but you also have to pay your bills. So, trying to look at the long-term sustainability and what the system will have to adapt to be able to have accessible, affordable care is really one of the big challenges.
And so is the answer more government funding?
I think it's one of the answers. I think that there's a lot of different things that folks are looking at. Clearly, you're looking at an expanded footprint for public school. One of the challenges with that is public school doesn't really align with most people's work days. So you still have to have some kind of childcare partnership around that. So we are in a lot of conversations trying to figure that out. More accessible paid family leave for those first few months of an infant's life so that there's less pressure and families could take those first few months to stay home and bond with their infant. I think we would be really supportive of that. And then obviously continued look at different public solutions. And, it's interesting that childcare is an area where there's been quite a bit of bipartisan cooperation in government. It is something that is recognized across the aisle as an issue that we need to deal with in our economy. How we get there is the trick, and where the compromises will come and how we try to put different proposals together will be, the work of the next few years.
The other thing that I hear from a lot of owners of child care centers, you just touched on, transitional kindergarten.
Yeah.
So for those listening who aren't kind of familiar with the industry, there's different ratios of adults to kids required by the state. Obviously, when they're younger, they're infant ages, you need more adults to kids. So that care costs more to deliver. And as you get into the older groups, and particularly that 4 and 5 year old group, the ratios are more favorable. And so this tends to be, like you said, where the child care centers can make their money. They're not breaking even, maybe even taking a loss on those younger ages as a way to, be able to help families and keep them in the system. And so now as transitional kindergarten came in, they can't get that full day care that they're getting at, a child care center. That's the trade-off. But for parents who can, make do with it's free, and it's hard to walk away from free. And so I'm talking to a lot of owners who are like, we don't know what we're going to do. We don't know how we're going to keep the doors open. Is there any relief in sight for them? Do you have any advice or suggestions?
Well, I'll speak to transitional kindergarten just a bit, which is a California model that the state of California has implemented that is all school-based. And it is, as you mentioned, really focused on serving 4-year-old children. Other states have done this, but done it differently. If you look at states like New York, where they actually started with a model similar to California, but realized it was impacting their supply of care for younger children. So they began to build public-private partnerships so that families could have that transitional kindergarten preschool experience in their childcare program, they would be able to have that full day, full year service, and it would be a partnership and funded in the same way as the school-based system. California's not gone that route. California's gone an all public route. New Jersey's another example where they have built this public-private partnership model that integrates the existing childcare system into the delivery, as has Illinois. I have personally, and my organization has been an advocate that we really need to think about that mixed delivery model and including the existing childcare providers in the delivery of preschool services so that they can sustain and so that we can sustain our infant toddler care supply. But that's not been the direction the state has gone thus far.
Do you see that changing at any point down the road, or do they feel pretty locked into what they're doing?
I think that there are differing opinions in the state legislature and in the administration, and typically what I see happen is we'll reach a pain point where something's going to have to give, and then we'll have a different conversation. And I know that the transitional kindergarten piece, you've heard from the childcare provider side, it's not so smooth necessarily on the public school side either, because the needs of 4-year-old children are quite different than the needs of older elementary children. And it isn't a hand in glove kind of fit for them. So I think you see varied levels of integration of TK into their public education system, depending on the district. So I would say we're very much in flux at this time. Mm-hmm. I don't know where it's going to land long term, but it certainly is a place where people need to be involved and really lift up what they believe is most beneficial, either to their own family or to their community.
How would you characterize the success or lack thereof of other programs where there's more of that partnership model?
They seem to be doing quite well. I know there have been several study trips done where folks have gone to look at what's happening in New York and New Jersey and Illinois. And they seem to be on a good path where there is the partnership. With any public system and any launching of new work, there's a period of adjustment. I'm sure that there are bumps in the road, but it does seem to be a good model to both offer a universal preschool education to 4-year-old children and support the early childhood opportunities for birth through 3.
Do you think we'll ever see a federal childcare solution, or do you think this stays with the states?
Well, a lot of the funding starts at the federal level. And the way the federal government has handled most of it has been through block grants, which means they send a chunk of money to the state, and then the state has to follow a certain amount of rules, but are largely able to implement their own local programs. We got close in the 1970s, before my time, but in the 1970s, there was a Universal Childcare Act that was vetoed by President Nixon. That was the closest I think we have come. There have been proposals in the Senate in the past few years. Senator Warren and Senator Murray both have had different proposals which would have dramatically expanded federal support for childcare. We will see how those things play out, but there certainly is discussion about the need for a greater role at the federal level, particularly as states, even states with a lot of resources like California, have limits on what they can do. And so there will be a point where California has exhausted its resources to be able to do this without support from the federal government. And so that will be a tipping point for us.
What are some of the other services that CCRC provides, Donna, that we haven't touched on yet?
So we do a lot of different work to try to support families with young kids, and we've been really building out and expanding our home visiting services, which are available to new parents. So when you bring a baby home from the hospital, it's a scary time if you've never done that before, and you don't necessarily have the kind of extended family you would have had. So we have home visitors that can go out and support new parents and just learning routines and basic development, and how to move into that space of being a parent. It's a big transition. We've also expanded our offerings around behavioral health. Another thing that got a lot of attention during the pandemic and since has been the tremendous stress on families and on children. And so we have a variety of different programs we've been doing to support families with access to behavioral health and mental health consultation for childcare providers, which largely goes in and works with the provider on how to manage different behaviors in children. Children, when they're stressed or have been through a traumatic experience, don't tell you what happened or how they're feeling. They show you, and they show you through behavior. So we offer supports to providers where we will have someone go out and work with a provider to make sure that they can think through transitions and how their program is structured and what type of attention a child might need so that they can really help the child be successful in their program.
What new directions is CCRC maybe headed in?
So I think I've said a couple times that we really are interested in holistic services for families. I think we've got a pretty fragmented system of support. We are really eager to expand our ability to make sure families get access to healthcare. So as we're providing them services and support for childcare, also making sure that they have access to health insurance or to medical services and support. One of the big issues with young children is developmental screenings to make sure the child is on track to develop at a typical pace. So making sure they get connected to developmental screening services. And we've been leaning more and more into basic needs for families, diapers and food and clothing, and just trying to, as much as possible, meet a family where they are when they come to our organization and wrap the services that we can to really help them succeed.
So give us more specifically the geography that you in particular serve.
Sure. So we serve the northern part of Los Angeles County, which is the San Fernando Valley, Santa Clarita Valley, Antelope Valley, Burbank, and Glendale. And then we also serve San Bernardino County, which is a pretty largest geographic county in the country. Our service area is about 22,000 square miles. So we have a pretty large territory that we cover. And we partner then with our colleagues around the state and have sister agencies throughout California and across the country.
So somebody who's listening that's in one of those covered geographies that Donna just mentioned, you can find out more about their services and how to contact them at ccrcca.org. We'll have that in the show notes, but I want to make sure that you have it, ccrcca.org. Donna, shifting gears a little bit, would love to hear about a particular challenge that you personally have overcome, whether it's on the professional side or something more on the personal side, and some lessons that you learned coming through that.
So, I think when we started talking about how I got to the job that I'm in now, careers are journeys, and we hit different milestones and pitfalls along the way. I think probably a big challenge that I faced was during the Great Recession. The organization that I was working for went through a lot of very difficult challenges and changes, and I was pretty tired. I was doing public affairs at that point, dealing with a lot of the reductions in services, dealing with media, dealing with local government, and a lot of contract reductions. And I kind of reached a burnout point where I just didn't, I lost my way in the reason I was doing this work. And I stepped away and went to do work with a friend who was doing environmental policy. So I stepped away completely, kind of, for a year, but I kept some of my fingers in the early childhood space, and it was not for me. It just was not a good fit, and I ended up ending that position and was sort of between jobs, had a young kid of my own, and really struggled to decide, do I try something totally new, or do I need to go back to where my core is and where my values are? And fortunately, I had a long-standing relationship with the CEO at CCRC, who, we had stayed in communication when I had made that transition, and I ended up with an opportunity to go back. And it's where I belong. This is the stuff I care about, and I think it took about, 6 weeks into being back to go, oh, right, why did you leave? What were you thinking? Because this, and I think as I mentioned, I have a degree in child development, and I really thought I was advocating for kids, but it was really during that time that I realized I was advocating for the parents. Because I was one, and I was in it, and I knew how hard it was, and how hard it is to put all the pieces together when you're trying to raise a family. And we don't make it so easy in the United States to be a family. We don't put all the resources and supports in place. We're very, very driven with economics and with, success in that way. And it's very hard to be a parent. And I think that was a real moment of clarity for me, where I really realized that the skills and talent I had were best used to try to lift that issue and to try to really make the system work better and make things better, so people could really achieve the families that they wanted to have.
Donna, say more about what caused you to burn out and to leave the space for a little while. It's
very hard to have things that you really care about dismantled. And I had to lay off employees. Those are very difficult decisions, particularly with people you have a relationship with over years. And then, a lot of the services that we had been providing, we had to end. And there were a lot of families who were in a very difficult circumstance without the support that we had been offering. And you feel like you failed, that you couldn't fight to keep it together and couldn't make it work. And so I do believe that, in hindsight, I don't know that there's anything that could have been done differently, but at the time you just don't feel like you can fix it. And that's for an A student, that's a hard thing to, that's a hard thing to accept. I usually feel like I've got my hands on the reins pretty solidly, but when things got tough, it was really difficult. And I think it's hard to live your life and not run into those patches. And you learn a lot about yourself, and you learn about what matters to you, what you are willing to do and not do. And I think that's part of becoming wise, older and wiser. You fall down and you get yourself back up and you start again. But it's always easier looking back than when you're in the thick of it, isn't it?
And what did you learn that matters to you, Donna?
I think that, as I said, it just really underscored to me that I really feel strongly that I want to use my skills and abilities to make other people's lives better. And that at the end of the day, that's where I want to invest my time to make sure that children have the best opportunity to succeed, that their parents are able to give them what they want to, and we build strong communities. I think that that's the most meaningful type of work in my life. So that's why I do it.
I'd be curious. I'm going to explain something I've gone through, something I've seen a lot of other either business owners, business leaders go through, and that's when you're in that transitionary state between things. It's really sticky. It's really murky. It's really uncomfortable. Like, I'll speak for me personally. My identity is largely attached, right or wrong, to the work that I do. And so if I'm leaving one opportunity and I'm trying to figure out what the next one is, I feel untethered. I feel like a part of me is unknown or missing or, waiting to be defined. I see you nodding your head. Does this describe your experience as well?
I think so. I think knowing what I know about human development and child development, transitions are the hardest things. And I had a colleague who used to talk about an example of a trapeze, that when you're swinging out on the trapeze and you need to reach to get to the next one, you have to be brave enough to let go of the last one. And that letting go of the old is
That's
scary.
a good way to put it. Yeah.
It's scary. At least you knew you had something there, but it's going away and you've got to move on to the next thing. But it's that in between where you feel untethered, you feel nervous and unsure of yourself, and you're better for it once you get through that phase. And the more times you do it, the more you realize, I've been through this before. I could do this again. I've been through this before. But it is an uncomfortable feeling.
Yeah. I'm kind of curious. You guys, your staff's pretty big size. 1,000, what'd you say, 1,000, 1,300?
Yeah, 1,300.
Yeah. Tight labor market for most folks that I talk to. I don't know if that's the case for the kinds of positions that you're hiring. What are some things that you guys have tried and found success with in terms of recruiting good folks, and then once you find them, holding on to them?
I obviously is a tight labor market, and we, as a nonprofit organization, can't be necessarily as competitive in salary as other entities can be. What I do find is we are so fortunate that there are many people who feel very committed to the work that we do and to the mission of our organization. We do our best to be as competitive as we can be with salary. We do our best to try to offer competitive benefits, flexible workplace, and are constantly striving to do better. But at the end of the day, I think that most of our employees who are with us for long periods of time are really committed to the work and are able to earn a good living at the same time that they're able to, as I mentioned, give back and try to do for others. And I think that that's a unique opportunity. Probably the area where we are stretched most thin in labor is in the actual teacher workforce. Because of the things I mentioned earlier, there just are not as many people going into the profession and getting an education in early learning and child development. So we have been doing a lot of work around apprenticeships, trying to find people who wouldn't necessarily have gone straight to a 4-year university, wouldn't necessarily have thought this at the beginning of their professional lives, but start to, identify that they're interested in working with kids. Maybe they've had their own children, and now they're like, oh, well, maybe this would be something I'd be interested in. And then giving them a more attainable pathway through an apprenticeship model where they can work and get the training at the same time. I would guess we're going to be doing more of that. And the areas where we need the most workers is really that classroom teacher side, home visitors, case managers who work with our families, those entry level positions, and trying to craft those jobs to be as appealing as possible. And then also getting out there and really trying to recruit at the community colleges and even in high school career technical education to identify folks who maybe didn't realize this was a career they could do, and try to connect them in as quickly as we can.
What's something you wish you could teach a younger version of yourself, Donna? It's really obvious to you now, but man, it would have been good to know back then.
Oh, I've never been patient.
I'm still waiting to learn that one too.
But I think if I could, in hindsight, if I had known when I was young that things do take time, changing things takes time, and you have to keep going back to things that are important to try to move them forward. And it's not going to happen all at once. It's just not realistic to think you're going to get everything right the first time, and that you've got to be willing to adapt and change, and that it takes time.
Yeah. Any specific mentors or books that have helped shape your career or you personally?
I have been so fortunate to have a lot of wonderful mentors in the field that I'm in. Women who set up a lot of these organizations that I had the chance to work with when I was in my 20s. Who I saw as our founding mothers in many ways. And I will say it's a little daunting to now realize I'm one of them, not one of the youngsters coming up. But they really blazed trails that were not there before. And I learned a lot from them. I have a colleague who was a member of the state legislature in California and have worked closely with her for about 15 years. And then some of my graduate school professors, just wonderful mentors at USC and even at Cal State Northridge in the child development program there. They still keep roping me back in to mentor the next generation.
Everybody takes a turn, Donna. Everybody takes a turn.
That's right. And I actually really like that part of where I am in my life right now. I really like mentoring young people. I like to see them succeed, and really am really enjoying that part at this phase of my career. It's really something to, I have young staff who've started with me right out of college that are now in committee assignments at the state legislature, doing amazing work, leading organizations and really taking off in their own right. And that's pretty cool.
What's a fun or interesting thing that most people might not know about you?
Mm-hmm.
You've done something crazy, you have an interesting hobby.
I grew up, my dad was in the entertainment industry, and I grew up around that. He was an Emmy Award winner. So I grew up in Los Angeles around television stations and television production and a lot of celebrities, which was just sort of a strange, surreal, to me was normal, but I think to other people, they would be surprised. But it's in a lot of ways helped me in my life, because I'm not easily fazed by.
You don't get starstruck or rattled
or starstruck. I don't. There are very few times I can think of that I've been like, "Whoa, that's really an important person," because I was around it enough to know that they were just people like everybody else. So that's probably something people don't know about my background. I was probably one of the few elementary school kids who sat in remote trucks for sporting events, because my dad would take me along and I would sit and watch them produce sporting events. So,
Was there ever any thought for you to get involved in that space?
I started off as a radio, television, and film major.
Okay.
I did.
And you decided that you found out that wasn't for you?
I knew what it would take to be successful in that world, and it just wasn't a good fit for me at that time. Ironically, I now talk to the media on the regular. I understand press. We put press conferences on. I still deal with parts of that. So my deep down skills come up every so often. But yeah, I did entertain it very early on, but not since.
Donna, I've just got one more question for you. But before I ask it, I want to do two things. If you like today's content, please hit the share, like, or subscribe button on your favorite podcast app. Donna, I also want to let people know the best way to get in touch with you. What would that be?
I think if they go to our website, they can find my contact information there. So it's ccrcca.org, and they can find me there.
Yep. Well, be sure to put that in the show notes for everybody. And last question I have for you, Donna, how do you see this whole space evolving in the next couple of years? Things that we haven't talked about already, what do you think maybe some of the big changes are that are coming?
There's a lot of uncertainty at this moment. We are a week and a half out from a national election, new presidential administration, new Congress, a lot of new elected officials in the space who I think will have their own opinions about what they think should happen in this space, if anything. I don't think the need for childcare is going to go away. I think that it is just a reality of our world and our economy. And I think that as we're grappling with as a nation, we're grappling with a declining birth rate. And that has lots of long-term implications for our country. And one of the things we need to consider is what are we doing to make it possible for folks who want to have a family to be able to do that. And many of the projects and programs we work on are related to that. And it'll be interesting to see how that plays out.
Well, Donna, I want to be the first to thank you for sharing both your time and your story with us today. I'm grateful for it.
And I really appreciate the opportunity, and thank you so much for the invitation.
Folks, that's a wrap on another episode of the Inspired Stories podcast. Thanks for learning with us today.